Good morning. I'm so glad that you are here today. My name is Winston Tan. I'm Vice Chair of Hematology Oncology, Mayo Clinic for Education. We are here because of you today, not because of any other agenda. The heart and the soul of this meeting is because of patients and caregiver. And I would like to encourage you not just to sit down, relax, and do nothing today. What I would like you to do is empower yourself, equip yourself, and make a difference in somebody's life. Did we hear that? And all the faculty here is vested in you. If we can do anything for you, let me know. First and foremost, I know the restrooms are important for everyone. The restrooms are to the right of that door, and once you get out of that door, make sure if you're a gentleman, go to the right, and to the left, it's the ladies. That is important. The cups are there not for decoration. You can take them home as a souvenir for the meeting, and we have our agenda. You probably have moments in your life where you have to make that critical decision of turning left or right. And that moment changes forever the direction of your life. And that destination defines your life. And I encourage you to look at yourself today. Try to understand who you are and where you're going. You need a destination, or else you're lost. Our aim today is to empower and equip you with the tools. We're not answering the why, we're answering the what and how. We're here to connect you with people. I want to remind you that this is a partnership between you and us. You and the people in the next room. They are our exhibitors. They're not here to sell you anything, and they should not be, or else you ask them to talk with me. They're here to basically get you connected with services that can help you in your journey as a caregiver, as a patient, or even a lay person, or a learner. And above all, at the end of the day, I want to change the culture that the word cancer is the disease that's terminal. I want to instill in ourselves that hope that changes your life, changes your attitude, so that you begin to see the light in the tunnel. Without patients, without caregivers, this meeting would be meaningless. I have Rodora here. I'll ask Rodora to come up here to tell her story and share with us how her journey had inspired her to move on. And I hope her story will encourage you.
Thank you, Dr. Tan. I'm Rodora Bantiga. I'm a nurse and a patient at Mayo Clinic. I moved here to Florida in 2006. I was living in New Jersey for 25 years. I was healthy, but in May of 2010, I had some hoarseness and choking on liquids. So I went to my primary care doctor, and he sent me to an ENT because my vocal cord was not functioning. The ENT at that time though, I was working at another facility. So the surgeon said that since my vocal cord was not functioning, there are only a few causes of that. Stroke, he told me right away. Oh, you're a nurse, so you would know. It's either a stroke or trauma or something pressing on your laryngeal nerve, which, gives support to the vocal cord. So after testing, biopsy, ultrasound, they diagnosed me with papillary thyroid cancer. Of course, I share that with my family and friends. And you get some responses like, oh, thyroid cancer is the most treatable one. But cancer is cancer. The letter C is not easy to hear, even as a nurse. So the surgery was on June 23rd. It was supposed to be one overnight stay procedure, but I ended up in the ICU, intubated, and was ventilator dependent. Apparently, the tumor was so big that it affected my trachea, and I had some respiratory distress. And they were not successful in extubating me after a few days, so I had to have a tracheostomy. That's the hole in the throat to make me breathe. And the surgeon told my family that I may not regain my voice back. I was discharged home with a tracheostomy and on thickened liquids as I was aspirating on thin liquids. It was not easy. Now I understand why patients don't want to eat those thickened liquids that you give them. Then doesn't taste good at all. Coffee is not good thickened at all. And the most difficult part, I think, was the loss of one of my senses, speech. You don't understand until you lose one of your senses, I guess. I was blessed to have my husband, my 2 sons, close family and friends who were there to care and support me. And some of them are here today to support me again today. After a week, the trach was removed and I was able to breathe on my own. And after about a month, I had a swallowing study and passed that, so I was able to drink liquids. As I said, the most difficult part was not having a voice and relying on a dry erase board to communicate. And it was very, as I said, frustrating. About 2.5 months later of diligently doing my speech exercises, my family got tired of my exercises, I started to regain my voice. In November of 2011, I was able to transfer work to Mayo Clinic. And then, on my follow-up, I found out that I had positive lymph nodes on my neck. So in February 2012, I underwent radical neck dissection and was followed by another radioactive iodine treatment. I am so fortunate to have the best Mayo endocrinologist, the chief of the department, Dr. Burnett, to manage my illness. When you have issues with your thyroid, you need to have a very good endocrinologist. In April of 2017, I had a thyroplasty procedure, that is to repair the paralyzed left vocal cord by Dr. Amy Rutt at Mayo ENT. And I know that this procedure is only available at Mayo Clinic. That procedure has greatly improved my speech and breathing, which has improved greatly my quality of life. Some of the people here know how I was talking, very effortful when I didn't have the procedure done last year. But now I can speak better. And also my best friend, what a coincidence, was diagnosed with thyroid cancer the same time I was, like about a month before that, in 2010. So we've been comparing notes the whole time, and this is also one great coping mechanism that I had, was to share it with somebody I know who's going through the same thing. Some people ask me, how did I do it? First of all, I really just relied on God. He's the only one who knew what he had plans for me. And then, as said, my family and friends. I know that everything is in God's hands, and I know that sharing my story is one of the purposes he has for me. Every moment is a gift, and every day is a blessing. Thank you. If anybody wants to speak with me later or during the breaks, please feel free to approach me. Thank you.
Everybody heard a miracle. We're not here to ask the why. We're here to answer what happened. There is a purpose for everything. Things don't happen by chance. At least that's what I believe. Things can happen because it's planned. We're here today to share with you value, not defined by me or anybody else. It's how you define value, whether it's quality, reliability, the ease of use, or the durability. But we're here to create connections that hopefully will bring value to your journey as a cancer patient and a caregiver. I told you we are here to meet your needs. We have this plenary session, we have breakout session, and this year I try to push the envelope. And we have 6 experts here who are totally yours to ask questions, to answer your needs. Hope can change everything. Could you think about a situation where there is no hope? A child with terminal cancer one day was in the hospital. He was so sad that his doctors called him and told his parents, "You have terminal cancer." All of us have what we call terminal events or moments that we are very low, that we say we are at our wits' end and we cannot, humanly speaking, do anything. But when that hope shines, when that hope reignites our energy, like Rodora, she now can speak, and she's inspired to share her story with somebody else. I know a lot of you here have your own story. Let me ask you, if you're a cancer survivor, to stand up and tell us that you value this conference. Please do stand. We want to honor you because you're here to state that it is not by chance that you're here. You're here because you're here to tell a story to inspire others so that we can move on. We together can do it. Thank you very much. Without your caregivers, there are moments when you cannot even lift a cup, go to the restroom, dress yourself up. Who is a caregiver here? Regardless of whether it's cancer or not, who have helped a relative, a friend, please do stand up. And I want to recognize you. You are your relative's partner. You made that difference. You see, almost half of the room. This is what we call value. We value each other. You share your lives with others. Together, we can help each other. I do not call that collaboration. Collaboration is a lame term because collaboration means I help you when I benefit from it. In this day and age, we often think about what's in for me. But I call it a partnership. A partnership means regardless whether it's good or bad, I'm here for you. And you as a caregiver, my friends, you are truly a partner. We can partner. Cancer patient caregivers and people who support us today. Without them, we would not be here. I like for those people who invited somebody to come to stand up, and also for those who support us in the Connect room to stand up. Let us recognize them. Please do stand up. These are the support groups, our partners, our pharma companies, drug companies, who really have that heart, and their souls are vested in trying to make a difference in people's lives. Yes, they have to make a living, but we're here to partner with each other, to share. And the important is that share that trust so that we can achieve our goals together. There is that rainbow of hope that inspires me every day, that actually helps me think that we have to capture every single moment because you are making a difference in somebody's life. That child with terminal cancer was quite sad. But one day, the school board decided, hey, this child has been not in school for 3 months now. Let's send a teacher to the hospital to visit this kid. So lo and behold, grudgingly, the teacher said, I'll visit this child. Why grudgingly? Because she didn't know what to say. A lot of times when our loved one, our friend, have terminal cancer, we often don't know what to say. We want to encourage them and we say, we understand. I would tell you that's a total lie. Do you really understand? I have been in your shoes. Really? So, to make the long story short, or else I'll be here forever, the child's teacher visited him, gave him a lesson plan. Next week, this is what you need to do in math. Next week, this is what you need to do in science. And she didn't say anything and left the room. The teacher felt very sad. I did not make a difference in this child with terminal cancer. The next day, the parent of the child, the mother actually, went to the child and asked him, "What did your teacher say?" It was the first time that the child's eyes opened wide. The child was smiling. The child began to move his finger. The child began to stand and put on his shoe. Why? I was so glad that somebody like my teacher visited me, because at least the school board think that I am not terminal. That's why they gave me a homework to do. Ladies and gentlemen, you're here to bring that hope. You're here to inspire. Even though you said something routine, that routine might have changed somebody's life. And that is the rainbow that I'm talking about, that rainbow of hope. Mayo Clinic, I have to talk about my institution, is a 3-site, 1 cancer center. It's in Arizona, Rochester, and of course, Florida, that I'm proud of. My colleagues here from 3 sites, 1 institution, many Mayo Cancer Network, are proud to say and are happy that our institution is committed to the patient first, and we value you. I hope I inspired you. I hope that applause means that you're gonna make a difference in somebody else's life today.